your mother-in-law is a witch, she's the one that tied your womb, that is why you cannot push like the normal woman. In my next baby, I'm going for CS, and CS is abnormal delivery. Okay, CS can cause you infertility. God forbid. It's not my portion. It's not my... Hey fam, welcome back to the channel. Ewoma here. How una day? Guys, from the title of this video, you can already guess what today's topic is about. But disclaimer, please. I am not a medical doctor, though I work in the medical field, but I am not a medical doctor. So please, this is not a professional kind of video. If you have any concerns, it's still best you talk to your medical doctor about it. So every of my personal opinion in this video are based off of my number one, personal experience, as well as experiences I've seen in the hospital and experiences of people around me. So with that being said, let us jump right into today's video. So guys, we'll be discussing this debate that is as old as man, if I say so myself, and that is the debate of cesarean or vaginal delivery. Which one is better? We know that this debate has been going on and on for a long time. People even go as far as calling vaginal delivery normal delivery and CS is abnormal delivery. Okay, people even go as far as shaming CS moms, saying they took the easy way out, or they are lazy women, this and that. But that is not true. I think the most important thing here should be the focus on making sure that both mother and baby come out of labor and delivery alive. Okay, that should be the most important thing. Which one is easier, which one is better should not be the focus. I guess that when they say which one is better, they're trying to talk about the one that is less painful, the one that has less mortality rate, but also the truth of the matter, it is not a one-size-fits-all. Issues of labor and delivery are always based on personal experience. What works for A may not work for B. Okay, there are instances where a woman is able to have a baby vaginally and then the placenta cannot come out. The placenta has to be delivered via cesarean section. Okay, there are cases where labor is even progressing very well. The woman gets to 9 centimeters dilated, and then the baby's heart rate drops, and then they have to run into the theater to have an emergency C-section. There are even cases where labor is very slow and they feel like, oh, this will end up in a cesarean section, and then everything just happens really fast. So it's not even a case of which one is better. It's a case of which one works for you better. Okay, there are also cases where a woman has had like 4 or 5 babies via cesarean section and they are all doing well. And there are cases where a woman has had 4 or 5 kids via vaginal birth and they are all doing well. There are also cases where a woman has gone on to have a vaginal birth after having a cesarean section delivery, and that's okay. And there are also cases where a woman has gone on to have cesarean section after having a vaginal birth. So you see why I said the issue of labor and delivery is never a one-size-fits-all kind of thing. So the focus here should be, how will mother and baby come out alive? Okay, so I, for example, had a very quick labor and delivery. So if I were to even engage in this kind of debate, I would definitely say, oh, vaginal delivery is better because it favored me. Whereas when I had my baby, the lady I shared a room with had a baby 2 days after. Okay, I had my baby on the 24th and she had hers on the 26th, and I met her there. But hers was a difficult labor. Even though she later delivered vaginally, hers was a difficult labor. So if this lady was to engage in this kind of conversation, she would definitely say, in my next baby, I'm going for CS, okay? Because vaginal delivery was difficult for her. So I don't know if you guys understand what I'm talking about, okay? So I also understand here that some people see CS as an easy way out, whereas it's not actually the easy way out, okay? CS is not easy at all. There are also other people that believe that when a doctor tells a woman that, oh, from the way we are saying things, you may have to have a cesarean section, the next thing you hear is, God forbid, it's not my portion. It's not my portion. It's not my portion. My enemies are at work. Some women even go as far as sneaking out of the hospital, and they'll go to the church and the pastor will be telling them, you deliver like the Hebrew woman. You deliver like the Hebrew woman. When the Bible talked about delivery like the Hebrew women, all he said was that they delivered, and before the Egyptians came, the woman has delivered, meaning both baby and mother made it out alive. Every form of delivery is supposed to be like that. Even if the baby was coming out through the mouth or from the nose, it is a normal delivery, okay? So let's not get into it. I think the purpose of this video is actually to enlighten women, okay? Let us enlighten and educate ourselves so that, this debate will end, because it brings a lot of stigmatization to some women, especially CS moms. Okay, you have cases where a woman tells you, oh, her mother-in-law came to tell her that, you're just here to waste my son's money. If you're having a cesarean section in our family, we used to deliver the normal way. We deliver the normal way. You just came here to chop our money and waste our money. Stuff like that. It happens. There are also cases where women are told, oh, your mother-in-law is a witch. She's the one that tied your womb. That is why you cannot push like the normal woman. Forgetting that, there are different factors that come into play when you talk about labor and delivery, or when you try to ensure safe labor and delivery. There's the size of the mother's pelvis, okay? Not everybody's pelvis is wide enough to accommodate the size of their baby's head, okay? There's that factor. There's the factor of the baby's size, okay? And when you're talking about the baby's size, you're also talking about it in proportion to the size of the mother's pelvis. If, for example, the size of a woman's pelvis is, let me say, 4 kg, and her baby, for example, is 4.2 kg, what do you think will happen? Obviously, the baby cannot pass the mother's birth canal, and so we're talking about cesarean section. If, for example, the woman has a history of high blood pressure, of course that woman is not supposed to go through the rigorous process of labor and delivery. And most importantly, what is the baby's heart rate like? The moment the baby's heart rate starts to drop, whether you're 10 cm, 2 cm, 9 cm, whatever the case may be, you have to have a cesarean section, because for every contraction a woman has, what you guys probably do not know is that the baby is not getting any oxygen supply. Yes. So every contraction, no oxygen supply, no food, no nothing. So that means that the less contractions, the better for the baby. So there's nothing like, even if it's 2 days, I will stay, I will wait, I will make sure, I will bear it so that I can have my baby vaginally. You're putting the life of your baby at risk. Let me just say something quickly. I understand that some people are like, why can't we go back to the Garden of Eden and make sure that Eve does not eat that forbidden fruit, because it was after she ate the forbidden fruit, God now cursed us. Let me tell you something, whether Eve ate that fruit or not, labor would have been painful, and let me prove it to you. Okay, let's turn your Bible with me, hallelujah, to the book of Genesis chapter 3 verse 16. I'm serious. Okay, so I'm just going to read it quickly for you so that we don't waste our time here. And it says that, I will greatly increase your pains in childbearing. With pain will you give birth to children. What that simply means is that the pain will be there. What God simply did was increase it, maybe from 2 to 100. But the truth of the matter is that the pain was always going to be there. Things just got more serious. So this one is not even a matter of if the woman has eaten the fruit, she has gone, she has gone. We are here facing the consequences. So very quickly, with all this being said, let us look at the opinions of other women as well, because sometimes in cases like this, everybody judges based on their personal experience, whether their own or people around them, but you cannot judge for somebody else. Okay, I, for example, I'm a team vaginal delivery because mine was very easy. While my neighbor, for example, might be team CS because for her vaginal delivery was very difficult. Okay, so that kind of thing. So let us quickly read some experiences of some women that have had to deal with all manner of things in the name of having children. Okay, childbearing is not easy, it's not a walk in the park. So if you know any mom around you, please give her a tight hug, be kind to her. It's not easy. We're only talking about the labor and delivery for now. We have not even talked about the postpartum aspects. Because what people forget to consider is that when you're talking about labor and delivery, there are different stages in labor and delivery. You have to consider before labor and delivery, during labor and delivery, and after labor and delivery, which is the postpartum part. And that part is very, 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 very important. In fact, sometimes it is because of the postpartum aspect that people draw conclusion on which type of labor or which type of delivery is better, okay, in their opinion, because of maybe how they healed postpartum. Okay, so yeah, we have to consider that as well. Before I read out the experiences of these women, let us first of all look at what started this whole debate in the first place. Okay, somebody asked a question and said, what opinion about pregnancy would put you in this position? And I'm going to put the picture of a man with knives to his neck. And somebody said scheduled C-section is better than vaginal birth. And someone else said, as someone who has done both, I can categorically tell you that the best is abstinence. Close your leg, you will see zoom. Okay, this person is choosing violence. I see. We know that abstinence cannot work. You don't want to have children. Let's move on. We have wasted too much time. Okay, this person said, I had a scheduled C-section. It ended up being an emergency C-section because I went into labor at 36 weeks. 1. I have permanent nerve damage from my incision. 2. I itched for 3 days straight like a mad woman. Spinal epidural has left me with unbearable back pain that deters me from heavy lifting. C-section healing process is so hard. The issue of labor and delivery is so spontaneous. You can have your birth plan and things don't just go the way you plan. First of all, we all know that the duration of pregnancy is 40 weeks, 38 to 40 weeks, okay? Now, this woman entered labor at 36 weeks, which means that that baby would have been born premature. That is preterm labor, okay? And because of that, she has permanent nerve damage from her incision area. I think that is very common with C-section. She also mentioned the itching. This could be a reaction to maybe the spinal block she was given. And then she mentioned this back pain. I've heard this a lot from women that had, C-sections because, you have to be given the spinal block so that you don't feel from your waist down. So yes, it is a very common side effect of having cesarean section. Even though there are some women that say they've never experienced anything like that, it is quite common. So do your research, okay? Do your research, but all and all, easy. This one said, none is better, my dear. None. Vaginal, aka V baby method of delivery, is a shorter version of pain mommy CS brings. Still, V baby's pain will feel like you will go and meet your maker. The feeling will be like it's been 2 years already. With mommy CS, they have to tear 7 layers, as in isi, eje, bakwe, before they bring your baby out. Let's not talk about the migraine that follows the aftermath of the CS pain, or how long it will take to heal, or the fact that a lot of us have to go back for rest. Itching cause the CS incision opened again. But when you talk about less risk, I think CS is better. There is less death rate for that. God bless all mothers, I beg. This person is speaking like she speaks from experience. She did mention the back pain because of the epidural. She mentioned the itching, and she even mentioned that some CS moms even have their incision sites opened again. I can just imagine after opening 7 layers, it will open again and they'll have to restitch you. It's not easy, but like she said, and she's very correct, none is easy. Although with vaginal delivery, the moment the baby comes out, the pain reduces. The pain does not go away because down there just went through a lot. In fact, after delivery, some women cannot sit down for days. Some women can't sit down for days because that place hurts, your butthole hurts, the front hurts, everywhere hurts. So actually, none is easy. None is easy, okay? Just do the one that is easier for you. Not even easier, better for you. Not easier, better for you. If you're good to go to have vaginal delivery, go ahead and just focus on the healing process or the postpartum part of it. If a C-section is recommended for you, prepare your mind. I think the important thing here is mental preparation. Mental preparation will save you from a lot of things. Do your research. If you're mentally prepared and you've done your research, you know what to expect. So you can try to walk around it to heal better. I don't know if that makes any sense. Let's move on. This person said, I've experienced both and both were easy. Did you hear this person? Let me read it again. She said, I've experienced both and both were easy. In fact, my second CS, I started my normal activities the second week. What I don't like about pregnancy is the first 3 months, and I was lucky with my third child because I got to know she was in there at 7 months, so I escaped the first trimester wahala. I need to look for this person and be friends with her. What? Someone is saying she has done both, and the two of them are very easy. The group of women I envy are women like this that says they don't know they were pregnant until like 2nd or 3rd trimester because what? First trimester is crazy. First trimester is crazy. To have you feeling like your body is not your own. And this woman here, not only did she escape first trimester, labor and delivery are always easy for her. That's why I said labor and delivery is not a one size fits all. Body differs. Everybody is different. For one person, she may heal vaginally quicker than when she had C-section. For someone else, a C-section might be better for her. People have different pain threshold, okay? People can bear pain on a different level. So moving on, this person said, Honestly, every option has its effects, either instant or long term. That is what I was talking about, postpartum. Did you know that CS can cause you infertility? How? I'm just hearing it for the first time. A- Ashman's syndrome or cervical adhesion can happen just because of CS. Okay, that means that your cervix can stick together with scarring in the process of the womb healing after undergoing CS. Ha! I'm just hearing this for the first time. Oh. Honestly, this is scary. And I must mention that this video is not to scare anybody, please. If you're a man watching this video, please don't be scared of what your wife will go through. Just be supportive. If you're a woman, don't be scared. Don't come and say because of this one you will not give birth again. I beg you. This is just to create more awareness so that we are better informed. Okay. They say ignorance is a disease. Okay, let's just be aware of what is going on with our own bodies as women. It's better than not knowing at all. Okay. She was talking about the cervix, sticking together, making it difficult for sperm to go into the uterus to fertilize an egg in the fallopian tube. I've done both, but I will still choose scheduled CS anytime, any day. The pain is crazy, but mortality rate for the baby is lower. Vaginal is natural but risky and can cause instant death. I would have said I don't want kids, but the joys of motherhood and commandment of God is superior. Forget that we are laughing. It's not a laughing matter. By now, we should all know the normal duration for labor. So anything outside that is prolonged labor, and that is risky for the baby. So I can understand why people feel C-section is better because of that. Because when you go in for a C-section, your baby is still breathing up until they bring out that baby, right? But when you're in labor and you've been in labor for like 70, 80 hours, I hear people say they were in labor for like 2 days. By the time the baby comes out, the baby will need oxygen. Baby will need assistance to breathe well because of the stress the baby has undergone, during labor. Said, raising awareness about cesarean section and encouraging mental preparedness should be a proactive approach rather than considering it only during emergency. Additionally, attending antenatal care is crucial for pregnant women. I think this person just literally summarized everything I've been trying to say, throughout this video, because that is what I was talking about. Mental preparedness. If you know what to expect, you know what to do about it. And some women don't go for antenatal. I don't know why. When you attend antenatal, you'll be taught a lot of things that you did not know before. And now you will now become aware of why certain things happen. Just like when some women felt like, oh, CS was just because doctor wants to collect your money. Oh, CS is just because the baby is too big. They'll not tell you that, but my auntie, her baby was 4.5 kg. She born am well. She born am through normal vaginal delivery. My own baby is only 4 kg. They say I no go fit push am. Forgetting that your auntie's pelvis might be even 6 kg wide, and yours is just 3 kg wide. So you cannot compare the two of them. So yes, I totally agree with this person completely. I think we should round up this video with this last comment that said, as someone who has experienced both, I would say close leg, abeg. Who will close leg? Who are you advising to close leg? which women? You want woman to go and tear her husband's clothes? Hey, please don't say that again. I detest pregnancy but love my kids. I wish there's a shortcut to giving birth, but there's none. And as someone who has experienced acute hyperemesis gravidarium from beginning to the end, the thought of getting pregnant sends shivers down my spine. I was telling someone recently there should be a way we can write letter to God to enjoy sex without pregnancy as married women that are done with babies without family planning or other methods of contraceptives. This person, has started a whole new conversation with this comment. I actually have a video on my channel where I talked about the different forms of family planning or contraceptives, the advantages, the disadvantages, and all that. I'm also going to link it in the description box for you to see. But like this person said, she wishes women can write a letter to God so that God can help us, so that we can chop and clean our mouth, okay, because of what she experienced during pregnancy. Imagine someone else was saying she was very lucky that all her pregnancies were very smooth. Someone like me, morning sickness is a must for me. First trimester wahala is a must for me. But some other people go through pregnancy without even experiencing anything. In fact, some people glow all through their pregnancy. I don't glow all through my pregnancy. And this woman's own is even worse because she experiences hyperemesis gravidarium, which is extreme vomiting, nausea, like Everything you experience your first trimester times it by 100. That is what some women experience, all in the name of pregnancy. Woman now will be looking for the easiest way possible to bring out that baby. And if a doctor tells her that, madam, if you do CS in 30 minutes your baby will be out, trust her, she would immediately agree, because of what pregnancy has done to her already. Even though I wish it was also possible for us to be able to, chop and clean out without having to go through the stress of worrying about family planning, because family planning comes with its own issues. I'll make an updated version of that video where I talk about the family planning methods once again, and contraceptive and all those things. But all those things have their own side effects. Some people struggle with weight gain when they use certain family planning methods. Other people struggle with acne, with bleeding, with mood swings. See, it's a lot. Women are just going through a lot. So please let us stop asking men what they bring to the table. If by now you've heard all these things and you are still going to ask a woman, what do you bring to the table? What do you bring to the table? The comments we just read only point to one thing, and that is that no one is easier. Okay, both of them have their side effects. They both have their pros and their cons. So the most important thing here is to reach out to your doctor if you have any concern and discuss with them. Okay, tell them your fears and concerns. They will be in a better position to guide you and advise you accordingly. I think as a pregnant woman, your aim, goal, and focus should be that as your baby is coming out alive, you yourself, you are coming out alive. Trust me, it is not funny for a woman to deliver and she loses the baby. Neither is it funny for a baby to be born and they say the mother lost her life, during delivery. Okay, let us just find the best possible way to reduce the rate of, mortality for both mother and baby during labor and delivery. So if you've watched this point and you've not subscribed to the channel, please hit that subscribe button, share, comment, and like this video for me. I really hope you found this video educative, entertaining, enlightening, and everything. Thank you so much for watching this video, and I'll see you guys in my next video. Bye.